Welcome back, everybody. For those who are new around here, my name is Anna, aka NeuroGal MD. I'm a double board certified neurologist and epileptologist, and I like learning, teaching, and making videos about all topics related to the brain. I'm really excited about today's video because we'll be watching neurology TikToks together while I make some fun educational commentary. How exciting is that? All right, I'm not too good at intros, so let's just get on with it.
Okay, you're up. Present the patient to me. Okay, so patient is 50 years old, said that randomly their right arm and their right leg got like really numb and heavy, and they felt like it was like really weak all of a sudden, and then you called a stroke alert, right? What? No. I pulled out the PHQ-9, and turns out that they do have mild depression, and I dug a little deeper, and they recently had a dog pass away. Her name was Sally. She passed away about 3 days ago, and it was kind of like tragic. Okay, what's their neuro exam right now? Yeah, that's the strange thing. All the symptoms are gone. It's as if it didn't happen. I'm starting to think conversion disorder. Okay, this is most likely a TIA, but we still need to call a stroke alert. I don't know, I'm really thinking with the mild depression coupled with the tragic loss of their dog Sally, that this could really be conversion disorder.
She does a really good job of capturing the essence of the neurologist and the psychiatrist. And it's so ironic that these two specialties are experts in the same organ, yet approach it so differently. To any medical student who's trying to decide between neurology and psychiatry, just watch this video and see who you identify with most, and then choose that specialty. I also wanted to just address conversion disorder just quickly. It's a psychiatric illness in which the symptoms resemble a neurological disorder, such as numbness, weakness, or seizure-like activity. However, these symptoms can't be explained by a neurological condition. So diagnostic tests usually are normal in patients with conversion disorder. It's important to keep in mind, though, that conversion disorder is a diagnosis of exclusion, regardless of a patient's psychiatric history or life circumstances. Should be ruled out with a thorough neurological exam and, if necessary, diagnostic tests like EEGs, imaging, or nerve conduction studies. Let's watch the next one.
Okay, I'm gonna rank doctor specialties by how terrified I am to work with them and or call them. This comment has absolutely nothing to do with that. I just thought it was like a super good idea and you should all see it. Okay, I'm gonna start off with nephrology because they are my favorite department to work with. I love those doctors and nurse practitioners. If you're seeing this, because I know you follow me, I am specifically talking to you. I think they're the smartest people in the hospital. I'm sorry to all the cardiologists and neurologists who are seeing this and are gonna hate me, but I love them. Next, cardiology. Mostly terrified. I feel like there's no middle ground with cardiologists. They're either like really chill and wear flip-flops to do heart casts, or they're the people that I accidentally said dude to one time and they were like, my name is this, and now I'm really scared and I don't like to call you. Neurology. I am terrified to call you, but only because I know I'm never going to have enough information, and I'm always going to end up on the phone for like 6 hours while you yell at me about your farming equipment and how you're not a regular doctor, you have a farm to run. Not that that's based off experience or anything.
How'd she know I had a farm? I guess I have known several neurologists with really unique hobbies. Never one with a farm though, at least not yet. That being said, neurology does have one of the highest burnout rates among all specialties just because of the debilitating illnesses that we see on a daily basis. I'd imagine that it's really important to balance out life with a creative outlet regardless of how quirky it is. I remember during my residency, I worked with a neurology attending who happened to be an exceptional photographer. Like, he won awards for his photographs. And he gave me a piece of advice that stuck with me to this day. He told me, Anna, he was from Colombia, you find a creative outlet or you go crazy. So I'm gonna pass along that advice from my amazing neurology attending. It is so important to find a creative outlet to help keep you balanced, especially in this crazy world that we live in. All right, next one. Yes, emergency medicine docs love ordering CAT scans on patients presenting with acute neurological symptoms. Ordering a CAT scan takes very little effort compared to a neurological exam, but both are important and should be used depending on the context and the urgency of the situation. CT brain scans are often used to quickly identify acute intracranial neurological emergencies like brain hemorrhages that may need emergent neurosurgical intervention. However, there are several major neurological emergencies that a CAT scan cannot detect. For instance, a CAT scan many times can't detect acute ischemic strokes. Ischemic strokes occur when a blood clot disrupts the blood flow to a region of the brain. So it's up to the neurologist to quickly perform a neurological exam in order to decide whether the patient is a candidate for treatment with a medication called TPA, or tissue plasminogen activator. TPA, when it's given quickly after stroke onset, helps to break up the clot and restore blood flow to the brain. Also, CAT scans cannot detect neurological emergencies that affect peripheral nerves or muscles, such as Guillain-Barré syndrome or myasthenia gravis exacerbations. These disorders can become neurological emergencies quickly, leading to weakness, paralysis, and respiratory failure if they're not identified and treated early. A CAT scan can't detect those, so it's up to the neurologist to perform a detailed clinical history and physical exam to diagnose these emergencies quickly so that the patient can be started on the appropriate treatment as soon as possible. So that's all I could find on TikTok today, folks. Please hit that like button and make sure to subscribe to my channel for more incredible content about the brain. We'll catch you next time.